So the main idea of contraception was started to prevent STIs. The idea of contraception 1700, 1600, when the idea was propagated, it was to prevent sexually transmitted infections and also to prevent unwanted pregnancies. But the main focus was to prevent STIs. So again, STIs, sexually transmitted infections, are prevented only if you're using a barrier contraceptive where the body fluids are not exchanged. In oral, in intrauterine, if there is no barrier involved, yes, you can get STIs. One more I forgot was injectables. There are some hormones which are again belonging to the progesterone family, or they are belonging to the family that stimulates the hormone center in the brain to release large amount of hormone initially and then suddenly stop the production. They are known as GnRH agonists. So they are progesterone, medroxyprogesterone injections that you can take, or you can take leuprolide acetate injections. So these injections, they have efficacy for 90 days, and you have to be very, very careful with the timing of these injections. If you've taken them 1st of January and your next date is after 90 days, which is 1st of March, and you miss that date and you go on 14th of March, there is a very good chance that that month your ovulation has escaped. So if you are someone who is not someone who is able to keep a very strict schedule, then injectables can become a little difficult for you. So I think the biggest umbrella is under contraception is hormonal contraception, which is for women. It is for men also, but it is not very popular for men. It is for women. That has been very popular and very widely used. So when we come to hormonal contraception, so there are contraceptive pills, there are combined contraceptive pills, there are progestin pills. We have to understand that there are two hormones which are in play in all these pills. There is ethinyl estradiol and there are progestins, which are synthetic progesterones. So with the various combinations, various dosages of ethinyl estradiol and progestins, these pills were generation 1, generation 2, generation 3, generation 4. That's how they have evolved. Older days, we used to get combinations of oral contraceptive pills that had ethinyl estradiol as high as 0.05. Now these ethinyl estradiol pills or pills that contains combination of both comes with their own set of problems. Benefits, yes, but problems also. They don't suit everybody, because at the end of the day, what you are consuming is hormones. So you don't know how your body is going to react to it. And then progesterone only, then that's how the idea of progestin only pills came, because ethinyl estradiol was the troublesome component. So they thought that we should delete it completely and then make pills which has only progestin for people to whom oral contraceptive pills do not suit. But then with progestins, the problem was that ovulation could escape. And if you are ovulating, there is a good possibility that you can get pregnant even if you are taking progestins. So that's how after some years there was centromin or meloxifene, which was introduced in the market. It was available in India as Saheli and Chaya, which was especially for women who could not tolerate combined oral contraceptive pills. Now with these oral contraceptive pills, there are many uses other than contraception also. But we are concentrating only on contraceptive uses. Government of India had Mala N and Mala D available free of cost at all outlets for women. Women were motivated, women were spoken to, they were taught, they were educated that contraception is their right, because there were a lot of septic abortions, a lot of abortions which were leading to maternal deaths and all those problems. So that's how oral contraceptive pills, because it is so easy to consume, you just have to take a tablet, that's all. So that's why it was very widely promoted. Now you have to understand that these hormones, you have to give your body some time, you have to do some research, you have to maybe try a few combinations to actually know what suits your body. And also your body's response to these pills change. So if an X pill is suiting you at maybe when you're 25 to 35 years of age, it's not compulsory or mandatory that the same pill will suit you once you cross 35 or once you cross 40. It is not compulsory that it's advisable for you to continue the same pill once you cross a particular age. So oral contraceptive pills with ethinyl estradiol and with progestins, nowadays we have very low dose contraceptive pills where ethinyl estradiol is as less as 0.02 to 0.01. What these pills do, they prevent ovulation. They give you an anovulatory cycle. The woman is not releasing an egg. If there is no egg, there is no pregnancy. That's how the combined oral contraceptive pills work. Now in combined oral contraceptive pills, what are the problems? These are hormones. They can cause gastrointestinal symptoms. You can get bloating. You can get lower abdominal pain, which is dull aching, and all the time it is there. You can get few changes in the vaginal discharge. It could increase. You might have a feeling of leukorrhea, where your underpants are getting wet with regular vaginal discharge. Another common thing is it can cause headaches. It can cause mood swings, which mostly interferes with your work or with your pattern of happiness or your pattern of receptivity in your daily routine. So there are headaches, there are mood swings, and now since we are using very low dose OC pills, initially when OC pills had enough amount of ethinyl estradiol, they would also cause thickening of your blood, so coagulative problems. People who use oral contraceptive pills were known to were more prone to stroke, to heart stroke, to MI, myocardial infarctions previously. Now, since we have low dose hormonal pills, these problems are not very rampant now. But even today, if you are someone who has a strong family history of stroke, a strong family history of coagulative disorders, a strong family history of myocardial infarction, if you are someone who is suffering from migraine or has occasional migraine, these combined oral contraceptive pills, be it generation 1, 2, 3, or 4, they can cause problems. So you really, if you are planning for an oral contraceptive pills, it is always advisable that you go to a doctor, you take a professional opinion, you be extremely thorough about your history, your family history, your own hormonal history, and then decide on which pill should you continue using. One most important thing I want to tell about oral contraceptive pills is it's a pill you're supposed to take every day. So which means that if you have taken a pill at 10 a.m. after your breakfast, next day 10 a.m. you're supposed to take the pill, because within 24 hours the effect will go away. It's an everyday thing, and it is human to forget a few pills. If you forget one pill, for example, it is Monday, I consumed the pill at 10 a.m. It is Tuesday, I consumed the pill at 10 a.m. I forgot on Wednesday. I am going about my work, and at evening 6 p.m. I realize I did not take my pill today. I can consume the pill at 6 p.m. I forgot the entire day. I just did not remember on Wednesday that I had to take my pill. Thursday morning, I'm having my breakfast, and suddenly I look at the strip and I realize that, oh God, I didn't take the pill yesterday. I do not take two pills together. The pill that has been missed for 24 hours is missed. What I do is I take a scheduled pill on Thursday and I continue the same way. If in the first week of your periods you are missing one pill, there is no problem. If you are missing two pills, there is no problem. If you have missed 3 pills, you need to abandon oral contraceptive for that particular menstrual cycle and immediately shift to barrier contraception. You cannot continue taking oral contraceptives for that cycle. If in the second week of your periods or your menstrual cycle, you have missed one pill, you have to use barrier contraception. You have missed 2 pills, you have to use barrier contraception. You have missed 3 pills in the second week, you abandon the cycle. You leave oral contraceptives for that menstrual cycle and you stick only to barrier contraception. In the third week of your periods, which is from day 21 to day 28, if you miss a pill or you miss 2 pills, it's okay, because it is an ovulatory cycle. The time period or the window of ovulation escaping is already gone. So in what week of your period are you missing 1 or 2 pills? It makes a very big difference if an oral contraceptive pill will work as a contraception for you. And that is the reason why consuming the pill every day becomes so important. Because at some point in time, the hormones in your body are also confused with what's happening. And so you might develop irregular cycles for a short period of time. Once the effect goes away completely, it might come back. All those problems are there. Now, all the lists that I said before, in whom oral contraceptive pills are not recommended. They can use progestin-only pills, or they can use centchrome or metolofine. They can use that. So one good thing about centchrome is you have to use it on a weekly basis. So the tablets come as 30 milligram tablets. The loading dose is 60 milligrams. So for first 12 weeks, which is first 3 months, you're supposed to take 2 tablets a week, Monday, Thursday. And then after that, once 12 weeks are over, you have to consume 1 pill every week. every Sunday, 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 Sunday. So it is easier to take. There is no hassle of everyday pill, but then again, you have to be very careful that you are taking the pill on the dedicated day of the week. So you put a reminder, you put it at a place where it is very easily visible so that you don't forget. Progesterone only pills can be given, but the only problem is that if you are mid-cycle along with progesterone only pills, it is always advisable to use a barrier contraception because ovulation can escape and you can still get pregnant if you're using progesterone only pills. So this was about regular routine oral contraceptive pills. One more thing that I wanted to add in oral contraceptive pills was that when you are taking these pills, there are a few pills that remain in your packet. You forget a day or 2 days or 3 days or something like that. So if you have 21 tablets from various packets, you can actually club them together, and if the expiry, it's not expired yet, you can actually put them in a bottle and use it. There is no problem. You can actually skip buying a strip when you have 21 tablets. So that way you can maybe be more efficient or, like not waste time, something like that.